Hello, everybody. My name is Kelly Sandaker. I'm the SURSAC administrator. Good morning. I'll be reading the disclaimer starting off. This meeting is being recorded and live streamed on TVW. This meeting recording will be shared on HCA website on a page dedicated to SURSAC meeting information. The meeting recording is open to public disclosure. Please do not disclose any private or confidential information. Guidelines for public feedback. There will be 5 minutes at the beginning of the meeting and 5 more minutes near the end of the meeting reserved for public comment. If you are not a committee member and you would like to make a comment during a particular discussion, please raise your hand for facilitator's awareness. If time allows, public comment on the topic will be invited before moving to the next item. Feedback that is not provided during the meeting can be submitted via email at any time to HCA ESB 5476 at hca.wa.gov. I want to go ahead and move into roll call. Jason McGill. Michelle Martinez.
Present.
Tony Walton.
Oh, here.
Brianna Peterson. Tim Cadello.
Present.
Sarah Melfi-Klein.
Present.
Rachel Downs. Haley Fuller. Alex Sheehan.
Present.
Amber Leaders. Senator Macon Makadingra. Senator John Brunn. Representative Lauren Davis.
Morning.
Morning. Representative Dan Griffey. Kayla Bentegreen.
Good morning.
Morning. Don Julian Saucer. Sean Meyer. Alexa Orr.
Morning.
Morning. Amber Cope.
I'm here.
Brandy Flood. Stormy Howe.
Good morning, Present.
Morning. Chad Enright.
Good morning, I'm here.
John Hayden. Nikki Lewis.
Good morning.
Sherry Candelero. James Tillett. Christine Lynch. Sarah Gillard. Donnell Kingsley.
Here.
Malika Lamont.
Present.
Addie Adwell.
Present. Good morning.
Kevin Ballard.
Present. Good morning.
Hunter McKim. Representative Jamala Taylor. Representative Gina Mossbroker. Just a quick announcement, Blake Ellison couldn't join us today, so Michelle Martinez will be standing in for Blake Ellison today. Thank you, Michelle. Always glad to have you here. Now I'll pass it over to Tony.
All right, good morning, everyone. Hopefully everyone can hear me okay. Maybe a couple thumbs up just to confirm. My name is Tony Walton. I'm the section manager for the Adult Substance Use and Treatment section within the Division of Behavioral Health and Recovery, and was asked to chair today's meeting, the July meeting for SURSAC. Wanted to thank Sarah Melfi-Klein for chairing the June meeting while Michael Langer and I were both unavailable. A couple of quick updates. As a reminder, Michael Langer did retire after 38 years of state service on Friday. Well, I guess today technically is Michael's last day, or maybe it was Friday, I'm not quite sure. But just wanted to let everyone know that Teresa Claycamp, the Deputy Director of Treatment and Recovery Programs at the Healthcare Authority, DHR, is talking with Tisha about who will chair this meeting long term and what that will look like, but also just wanted to make sure everyone knew that Teresa was appointed as the Deputy Director. And Teresa, thanks for coming on camera. A couple of other quick updates. Today is the beginning of state fiscal year 25, so that's exciting, July 1st. So we are, ever since the supplemental operating budget was passed, we've been developing programs and learning and trying to identify ways to operationalize new work. And a lot of that work starts today, technically. We're also submitting our state opioid response grant application today. And so a huge shout out to that team led by Laura Weed and getting that application finalized. And then also a couple of other grants we're planning to submit in the next couple of weeks, a BJA, Bureau of Justice Assistance, RSAC grant, which is for residential substance abuse treatment, as well as the COSUP grant for comprehensive opioid, stimulant, and substance use programs. It's another BJA grant. So a lot of work happening already, and I mean constantly. So just wanted to kind of add those highlights. Also, I thought it was relevant, and for this group, it's been exactly 1 year since the state's laws around criminalized possession of controlled substance have changed to a gross misdemeanor. So just kind of throwing that out there for consideration. Maybe for a future meeting, we could work with Administrative Office of the Courts to pull some data to identify, since those laws have changed, have we really seen significant increases in the filings of possession of controlled substance? I think that's something that would help guide future conversations. We've heard anecdotal feedback that some jurisdictions are definitely arresting and citing and also charging individuals for possession underneath the gross misdemeanor statute. So it might help to have some data to indicate what's happened over the past year, to see if we're seeing more people in the criminal legal system that are being charged with the UPCS charge or other charges related to substance use and substance use disorder. I think that's growing important, just highlighting some recent news stories. Hopefully everyone has heard over the weekend that the federal Supreme Court ruled in favor of cities and counties and other jurisdictions and their ability to charge somebody for being homeless. I think this is important to highlight, especially in the context of the conversations we have within this meeting. And then also jurisdictions like Burien and Mason County are looking at other ways to either have a punitive response to homelessness or otherwise otherwise continue to criminalize behavioral health. And so I think that that's just important to note and highlight today. Sorry, give me 1 second. Wanted to provide an update on Recovery Navigator program data. We received a lot of feedback during the June meeting, really helpful feedback, and we developed an internal working group that will be meeting monthly and taking that feedback and categorically looking at it and identifying exactly what the feedback is, and then developing a strategic plan as to how to take next steps to either incorporate that feedback into the data collection or to come back to SURSAC and give updates. Plan on having it be a standing agenda item to ensure that we are have some sort of transparent feedback loop where we can at least have a tracking document which will say, here's some of the feedback we received regarding R&P data collection, and these are the steps that we took, and these are some of the barriers that we've identified to ensure that some of that information isn't lost. I want to reflect quickly, noting that a lot of the feedback that we received during the June SURSAC meeting was provided by a number of different people. We received feedback from committee members, non-committee members, and there was, and I just want to extend an appreciation for everyone that did contribute and participate in that conversation, because I think there might have been some ambiguity in the past around like at which points somebody has the opportunity to participate in the SURSAC meetings. We have our dedicated public feedback times on the agenda, and that is just to ensure that we're holding that space and that we are not, that we allow that time within the ongoing conversations to ensure that anybody that's not a committee member has an opportunity to provide input. But I just want to make sure everyone knows, at least for today's meeting, like if you want to contribute, if you feel like there's something that, and you're not a committee member, feel free to raise your hand. I think that it's been a little unclear in the past as to how somebody that's not necessarily on the committee can participate and contribute. And I think that it's important that we do have an inclusive environment that is open and that we can have an open dialogue. And that brings me to my last point, which is during the June meeting, there was an altercation and there was a point in which it felt like the entire tone of the meeting took a turn. And I just want to draw everyone's attention to the group norms and expectations that we established back in December of 2021. They are available on the SharePoint site. Things such as assuming good positive intent and showing mutual respect are really critical in creating a safe place. And those don't apply to just the SURSAC committee members, but also everyone else in attendance, including our guests from regional areas and state employees. And so I just really want to make sure that while we talk about really complicated topics like homelessness and substance use disorder and the intersection with the criminal legal system, that we do have a really safe place where people feel like they can bring their true authentic selves to the conversation and share and provide input without any sort of fear of retribution or that input is going to be taken a certain way. So just please do remember, we assume good positive intent from everyone when they show up in here, and also just showing mutual respect to everyone as well. Looking forward to today's conversation, today's meeting. I think we have some great presentations. We're going to talk about 6109, which has been a topic in the past at SURSAC that's come up a couple of times. And we'll continue to, we'll learn about a SURSAC recommended program, the PREE program. That was one of the recommendations that came out of the SURS plan. And hopefully provide an additional opportunity for conversation and dialogue that will help continuing to move this forward. So with that, I'll stop after rambling for a little bit, and hopefully I'm still on time. And where do we go from here, Kelly?
It's going to be,
Well, actually, you know what? I'm so sorry. Does anybody have any questions or comments? I said a lot there, so I just wanted to kind of provide a stopping point to see if any. Okay, I'm gonna need help with
Malika.
Oh, Malika, go ahead.
So, as a person that was on the receiving end of, thank you, Tony, for your words first. And also as the person that was on the receiving end of what felt like an attack, I appreciate that you acknowledged that it occurred. I apologize for anything that was that, like, my fervor in trying to get to the bottom of some of the questions around data and to make it understood that you know, when we erase people from data, it can be really harmful. And I but I'm going to be frank. This feels kind of like it was I don't know if this is an apology or if it's kind of um a blaming of the members. That's what it feels like to me. And I'm not, and you and I have like a lot of history together. So I'm going to take it as assuming positive intent that this was an apology for that interaction, from you, because I do believe that from you. But I'm hoping that we can move forward as an entity that, all of us have been called into this group for a reason. And, we're not just saying things willy-nilly. We have like expertise that goes beyond just participating in this group.
Thank you, Malika. And I think my intent behind sharing that was definitely to ensure that everyone in attendance does follow the group norms and expectations, and that we do have a safe place. And I hope you continue to provide input in your perspective on these topics, and everyone else does as well. I think it's so incredibly important, and we captured everything that you shared, Caleb shared, Hunter shared, Susan shared from the last meeting, and 100% agree that data collection around Recovery Navigator program is so critical, and that we need to do better. And we need to do better because people continue to not get access to services. They continue to get arrested and involved in the criminal legal system and continue to die. And so thank you. Thank you and everyone else for your participation.
So the next up on the agenda is the public comment period. So if anyone who is not a committee member has a comment that they would like to share at this time, please raise your hand and we'll be happy to hear what you have to say. Yeah, Shelley, go ahead.
Good morning, everyone. As someone that's attended all the SURSACs and all the subcommittee SURSACs, I do want to say I appreciate what you said, Tony, and I appreciate that HCA, I hear HCA saying they're going to have weekly internal meetings on this. I just want to draw attention to that there's a lot of great minds in this committee that are willing to give their advice and their help. So I would love if HCA would include them in bettering the information, because everyone here understands this is deeply complicated work, and we're doing things the state hasn't done before, and that we need support from all of these great minds in this group. So I hope HCA can reach out and incorporate and ask for their help and not get so defensive when it is given, because not only they're not here just critiquing, they're offering their support. I heard Caleb offering many times suggestions of how this work can be improved. I hear Malika doing the same. I know that there's been experts brought to HCA offering to them and them being denied to allowed access to the data team. So I hope it's not to be defensive. It's not to defend you guys or to be, I don't know, just take opportunity when it's there. This committee has great minds. Please use them. That is all. Thank you.
Thank you. Did you want to say something?
Oh, no, yeah, thanks so much, Shelley. I think, sorry, I was putting the links, I kind of like referenced Mason County and Burien and a national Supreme Court ruling. I thought it might be helpful just to share share some of the news articles with that. Shelley, yeah, I 100% agree. I think we're gonna meet internally, talk about this, make sure that we are bringing the specific feedback that we received and showing it on the screen, presenting it on our virtual screen at subsequent meetings, and then 100%, yeah. If it makes sense, and once we get to the point where we kind of have a process in place to bring in external subject matter experts into that conversation, we'll definitely loop back around. But I thank you.
All right, so not seeing any additional hands, want to open it up to committee members. If you have any walk-on item requests for today's meeting, if there's time at the end of the meeting for additional items, now's the time to raise those. We'll see if we can get to those. Any walk-on items? All right. Then we'll go ahead and move on to agenda item number 4, the SURS plan implementation update and consultation regarding training for caregivers of youth with SUD. And Chloe Wilkins, if you're on, I'll hand it over to you. Oh, I see you. Great. Hi, Chloe. The floor is yours.
Good morning, and good morning, SURSAC members and the rest of the community here. I'm Chloe Wilkins, she, her, from the Division of Behavioral Health and Recovery at HCA in the prenatal to 25 section. And my focus is on youth and young adult substance use disorder and co-occurring services. And it's my pleasure to provide an update on the training for families and caregivers who are seeking knowledge and skills to support a young person who is engaged in substance use. Beginning in March 2021, we have partnered with Washington State Community Connectors and En route to provide 12 16-hour trainings throughout each contracted year. These trainings are advertised for parents and family members by parents and family members, highlighting the importance of peer work within family systems. In January of this year, work began to include additional modules to this training to address the requirements in Substitute Senate Bill 5536, which includes topics that are related to foster-involved youth and their families and caretakers, suicide preventions, and medication for opioid use disorder. These modules are to be included in the next iteration of trainings, anticipated to be released this month, July 2024. A version of this training can also be accessed outside of the scheduled virtual trainings through online and self-paced modules at sudwashington.com. I'll put that in the chat, contracted through En route. And these trainings are advertised through Washington State Community Connectors Community and Provider Network, Gov Delivery Messaging, the Athena Forum, and in collaboration with DCYF. It will be shared through multiple channels, including but not limited to juvenile rehabilitation, extended foster care, their SUD program regional leads, and their child welfare provider network. Looking ahead, we recognize the difference between what was directed in 5536 and our understanding of the SURSAC recommendation 4. We are thinking through to what could be adjusted to better align what was legislatively required and with the SURSAC recommendation, including making these trainings more accessible to families and caregivers and incorporating an evidence-based model for skills development. Additionally, we would like to provide opportunities for community feedback as the new curriculum is developed. I would be happy to return with more updates as we continue to work through the details if this group would like. And if anyone on the call has already sorted through the differences between 5536 and the recommendation 4 and wants to share, I'd really appreciate that and would be willing to discuss further. And to set some shared expectations as we sort between what was recommended and what has landed in legislation, it will really be used to inform what resources are needed to get from where we are to where we want to be. We may be limited in what we can deliver without or prior legislative and funding support. So I'm going to pause here just for a moment, and I'm going to add a few things to chat about this training so people can access that. Oh, thanks, Tony. Along with my contact information. And I really appreciate being able to take some time here to allow to share about this project and look forward to the feedback.
Thanks, Chloe. I think there's a couple of questions. We're just getting those queued up for you.
Yeah.
First one I have is Lauren Davis.
Good morning, Chloe. Thank you so much for the update. So I was the legislator who had authored the I think it was in 2019, the initial, it was called SUD Family Education, which is what went through En route and Washington State Community Connectors. I ran into them at the behavioral health conference, but one of the pieces of feedback I gave them that I'll also give to you is that when I put that program in the budget 6 sessions ago, the way it was originally envisioned was that it was an outgrowth of a vacuum because NAMI has courses, NAMI Family to Family and NAMI Basics for families impacted by someone with mental health challenges, and there was no such equivalent for families impacted by SUD. But the way in which they're offering the trainings, it's 4 days in a row in 4-hour blocks, which is definitely not very accessible. And sometimes they're in the evening, but they're usually during the day, not accessible to really just about anyone. And I appreciate that there's an online self-paced, but the intent was really to be modeled after that NAMI model, which is 8 to 12 weeks, where you're sort of in a cohort and you get to know the other families. And it's like, a couple hours in the evening where people could actually attend, not 4 days in a row. It's like couple hours a week for 8 or 12 weeks. So I just wanted to pass along that feedback. That would be my suggestion in terms of how to structure those trainings to increase participation. It sounded like they were only getting like 10 to 12 participants per training. And I think I certainly couldn't attend a training that was 16 hours in a week, back to back to back. So that was one piece. The second piece of feedback I wanted to relay is I need to try to talk to the en route folks, but when I initially envisioned that, my mama taught me never to assume, but I thought that they would have invoked more of sort of the craft model, which is as far as I know pretty much the best evidence base we have in terms of support for families in a non-coercive, non-confrontational way that is most efficacious actually at supporting that person in their recovery journey in terms of evidence. It is my understanding when I asked WSCC about that, they had never heard of craft, and I'm not sure if this was actually based on that or not. But if we're doing a redo, I do think it would be I think it would be wise to lean on the best evidence that we have, rather than, modules that they come up with that may have serve a purpose, but aren't rooted in the strong backing that we have from craft. So those are my 2 thoughts about scheduling and then using our EBPs.
Yes, really, really appreciate that feedback, Rep. Davis. Accessibility is priority. If we're having this training and people can't get to them, that's definitely an issue to resolve. So appreciate that. And kind of in the beginning stages as well of researching craft, community reinforcement, and family training for folks that aren't aware of that acronym, and look forward to continue to receive feedback from that as well. Thank you.
Next person, next member, Amber Lynn.
Hello.
Hello.
I was on the committee that helped to write this recommendation, and craft is named in this recommendation. I was gonna just reiterate what Rep. Davis was talking about, the evidence-based practices, and the evidence that we have, how efficient and how well craft works. I think that one thing that was missing out of your list of ways that you're distributing these trainings is these trainings aren't being offered through like schools or anything like that, where they could maybe be catching these families before they enter into agencies like DCYF or the criminal justice system. And we're really missing an opportunity there, I think.
Yeah. Thank you, Amber. Absolutely. I think schools is a missed piece, and I'll make sure to add that when I'm thinking about distribution. Appreciate that.
Might want to look into community organizations like the YMCA or something like that as well.
Thank you.
And if we're looking at models, the safety first model is actually a well-researched one, and that is put out by the Drug Policy Alliance. And it has been tested in both urban and less than urban, privileged and not privileged school districts. So there's an evidence-based for that one as well. And it is real talk about the risks of, substance use, but also education about what they are, what they do to a person's body, so that youth can really better understand instead of just saying no,
Absolutely. Was that, I believe that was Malika. I can't really see from my screen.
Yes.
Okay.
Yes.
Thank you so much. So safety first model as well. I appreciate that.
Patty Adwell.
Thanks so much. I just wanted to reiterate what Amber said about schools and also add more explicitly treatment providers to the list. I'm an opioid use disorder nurse care manager, and I spend a ton of time talking with families and really feel this gap of like not places for them to receive education, and also want to reiterate craft. I think craft is a great model, and it does have strong evidence and should be incorporated.
Great. Thanks, Addie. I love the craft fans. I am as well. And I would love to, if you have good resources on those provider networks as well, ones that you have in mind, please feel free to email me as I continue to look for that as well. Thank you.
Next committee member is Tillett James.
I have a question. So is there any kind of like stipend policy attached with it, say for like a low income family that can't afford to miss work but would like to take that training?
Thank you. No, not that I'm aware of, but I appreciate that idea, and I'll take that back for feedback and consultation. Thank you. That's a great idea.
I see no more hands.
All right. Thank you so much, Chloe. I don't see any additional hands, so we'll consider that piece of the agenda complete. Thank you so much.
And
thanks
thank you
everyone
everybody for the feedback. Yes, appreciate it.
All right, our next agenda item is another SURS plan update and opportunity for consultation regarding pathways to recovery for employment and education, also known as the PREE grant program. And Lisa Bennett-Perry, I will hand it over to you for that.
Hello, everyone. Thanks for having me back. Let me go ahead and start my screen here. Slideshow from beginning. Does everybody see that?
Not yet.
Okay, let's try that again. How about now?
Yep, thank you.
Yes.
Okay, good. Well, again, thanks for having me back. So just for full disclosure, the end of the year actually happened June 30th, as everybody knows. So we did our dingest trying to pull the data together to be able to support, to be able to give you the updates, but there's a little bit of lag in it. So I just wanted to say that right up front. So I'm going to do a little bit of a review for you who are on the call that maybe weren't on before. This was from Proviso 33. I'll read it. Healthcare Authority, Division of Behavioral Health and Recovery was assigned to Proviso 33 to establish an employment and education grant program designed for persons with substance use disorders. These programs are funded through Washington State Opiate Abatement Funds. In section 27, it specifies the amount of the subsection is provided solely for the authority to provide grants to providers for employment and education services to individuals with substance use disorder. And the grant program shall employ low barrier application and give priority to agencies that demonstrate priority to serving Black, Indigenous, persons of color, and other historically underserved communities. The update is 5 agencies did receive the PREE grant. They were chosen, contracts were executed between December 23 and January 2024. Given agencies time for the startup, services begun February, March. The priority was given to agencies that demonstrated established history in serving the target population of Black, Indigenous, persons of color, and other historically underserved communities. In addition, agencies that demonstrate 50% or more board members identified as Black, Indigenous, persons of color, or other underserved communities, including 2 as LGBTQIA+, and organized that demonstrated a majority, more than 50% of the participants served to meet the target population. And then, of course, a history and commitment to providing support employment services. These are the 5 agencies: Consistent Care for Peers, Friends of Youth for King, trying to touch also on serving youth, Native American Reentry Services. They actually serve statewide, and so that's why I didn't put a county there. Pure Washington for Thurston, Seattle, and Yakima Neighborhood Health for Yakima. Just a little list of pre-services that individuals receive under this grant. This is based on the IPS model, the evidence-based model of individual placement and support. We also recognize that not all the evidence-based practices have that cultural, racial, and ethnic sensitivity. So in looking at the IPS model, for example, in working with NARS, we also looked at how best to adapt that to the population that they're served. Zero exclusion as one of the IPS models. Eligibility is based on individual choice. Each individual also received that discovery and assessment piece, employment planning, job development, and or education track advocacy. And then, of course, the follow-along support for job seekers and the employers, and then benefits and education. The funds also have a barrier removal and education funds, which really makes this really unique and exciting to be able to work with people, not just to provide them the employment services and connect them to employment, but also to be able to help them when there's barriers in the way, and often there is. So the funds also went to vocational and technical college for up to a year. And then occupation-specific enhancement education, high school equivalent or GED, costs associated with school or employment like books, equipment, tools, childcare, work, or interview clothing, just naming a few. This is not all inclusive. Transportation, bus passes, gas, small car repairs, short-term insurance installments, reinstatement fees, cost of a license, all these things that deter somebody from being able to be successful in employment or education. So a little of the data updates. So as of June, again, there's a little bit of missing data because there was a provider that we didn't get all the data from, considering it ended on June 30th, but this is from March through June. The number of pre-enrollments for the year is 397. Number of vocational plans completed for the year was 259. Number of individuals that received barrier removal funds was 192. And the number of employment starts 65, education funds 43, and number of education starts 36. And then there's also a section for, vocational certifications or industrial certification, high school, so forth, was 18. This is kind of like the same information on a pie chart. This seems a little bit overwhelming, but the number of pre-enrollments is here in the blue section. And then it's broken down, number of plans completed, number of employment starts, and so on. Race and ethnicity. So for the pre-grant, as you can see, 110 people, the top category is American Indian and Alaska Native. The second highest category of people being served is Hispanic and Latinx. The third category is Black and African American. And then we have white, and then other. Talking to employers that chose other, that might be 2 races. And so they didn't identify, in each one of these categories. So I think next year what we're going to do is we're going to change that so we can capture that a little bit better. Then we also have Native Hawaiian and Pacific Islander 9, Asian 9, Middle Eastern and North African 3, and there's prefer not to disclose and then none. Then we have a breakdown of percentage identified as 2S LGBTQIA+. And after talking to providers, I don't believe it's only 14% of the people that identify in this area. We have 17% where it's not, nothing was listed. I think this is a training issue, and something we'll definitely be working on for year 2. The same for here for gender identity. We also included housing status upon enrollment. So based on this, 245 of the individuals that enrolled in the pre-program were housed, but there was 111 that weren't housed at the time of enrollment, and then 27 that were at risk of losing their housing. And then, of course, there's the didn't know and enlisted. I also thought it would be interesting to know the education status upon enrollment. So 163 uncertain. That was us working better with the providers to gather that information. Year 2, I'm sure, is going to be much better. But it'd be interesting to know that upon enrollment, we had 92 people that had completed high school or their GED, some high school at 56, some college was 31, vocational apprenticeship and or certificate 16, 5 had middle school education, and then 2 college degree, 1 graduate degree. Okay, so now I have a success story as soon as I find it. So Pierre Seattle shared a success story with us that I thought you all might be interested in hearing. So Jay started coming to Pierre Seattle in May and learned of the PREE program. Jay expressed interest in going to work, so was invited to get to know the pre-employment specialist and what the PREE program entailed. the pre-employment specialist asked Jay if he would be comfortable doing goal setting and if he had thought about what he wanted to do for work in the future. After sitting down with Jay, the pre-employment specialist learned that Jay was in the process of applying for SSDI and was not sure to what degree he wanted to be employed. The two talked about the parameters around SSDI and being employed and what was allowable for income. Jay also told the peer specialist that his housing situation was shaky because he did not have steady income. So the pre-employment specialist and Jay had a few follow-up appointments, completing a career profile. Jay was enthusiastic, but still was apprehensive about working over 12 to 16 hours a week because of the SSDI application. But after working with Jay and Jay, what would you say, looking at what his past work experience was, identifying that, yes, he has marketable skills, and looking at what he would earn potentially on SSDI and what he would earn if he was to go back to work. Jay, I don't know, built momentum and decided to move forward with employment. And since then, the pre-employment special, I went off script, I'm sorry. The pre-employment specialist worked with them on doing some online application and some job development. The ending goal and what we're looking for is Jay was able to secure full-time employment and now has stable housing. And that's my success story. And then this is where we go to any questions.
See a hand up. It's taking me a moment to. Oh, yeah, Representative Davis, go ahead.
Hi there. Yes, thank you so much for that presentation. That's fantastic. And I'm sorry to be asking so many questions. This was a program I was also quite involved in. Just for context for folks, obviously this came out of the SURS from our group in terms of recommendation, but I have been covertly or not so covertly since I became a legislator, trying to recreate a program that we used to have that some OG folks will be familiar with, that was called ATR, or Access to Recovery. And we had 13 years worth of ATR across 4 iterations. It was federal funding, and it did a lot of these things. It provided basically recovery support services, recovery housing, and employment and education pathways. Covered a lot of the expenses that you mentioned. So anyway, this was I kind of see this in that vein of trying to make sure that we provide those supports again that keep this disease in remission, and also just for people who are still in active use. I saw a really compelling presentation I was at this drug policy conference in Montreal a couple weeks ago, just related to people still in active use in the employment sector, and obviously still lots of benefits as well. So a couple things I want to mention. Number one, I just really want to applaud you around the population served. I sit in a lot of presentations with a lot of feedback around data of population served, and it's rarely, if ever, what you showed, right? Which is our BIPOC community being truly centered and being served disproportionately in a way that is really encouraging. So great job in terms of leading with an equity lens. Given that you're serving such a large percentage of our American Indian, Alaska Native folks, it may be worth. I think they're having a big old tribal opioid summit. I think this month that the legislature is funding, but it might be good to make sure that you're connected with all the tribal work that's going on, since you are, or at least that one organization, if they're serving the preponderance of our Indigenous folks. And then the two things I wanted to mention, like sometimes I joke that maybe I'm a closet fiscal conservative, but I want to make sure that we are, obviously the Foundational Community Supports Program uses the IPS model as well. And, I want to make sure that this is seen as sort of augmenting foundational community supports. I know that there was recently kind of we stopped accepting new referrals for FCS. I can't remember if that was for employment or housing or both, but I basically just want to.
Oh,
Anyway, both, okay. But I just want to make sure, and if that's the case, if there is no FCS, then I think, it's fine to just use this. But should such a time return as we have FCS as an option for employment, obviously the preference would be that we are connecting these folks to FCS to get those IPS services, and then this is really seen to augment or for people who aren't eligible for SCS rather than just sort of replacing, because that would be sort of the best way to steward the state funds. And then the last comment, another program that I had funded also in 2019 was these benefits navigators. And it's my understanding that HCA recently stopped funding those. Those were at the Washington Recovery Helpline. But the entire reason that I funded those programs was because it became clear to me that a lot of people with SUD qualified for a ton of programs that I knew because of sitting in the legislature, that the legislature was funding things like free college tuition, the Washington College Promise, things like childcare slots. I knew that people were eligible just by very nature of their income, but it was my perception that people with SUD were not aware they were eligible for this huge myriad of things. And so when you listed the eligible things that could be the funding could be used for, it's my hope that we are absolutely maximizing the heck out of the Washington College Promise. The majority of this population, based on the data you shared with housing status and such, would likely qualify for the free college tuition that the state offers based on income. Similarly, the vast majority of these people were about to make, we have the Working Connections childcare program. We also have ECAP is about to be fully on entitlement next year. So anyone who is income eligible would receive an ECAP slot, which is the state's version of Head Start for folks who aren't aware of preschool. I say all this to say, I'm hoping we're milking those programs and making sure that our people with SUD who've often been left out of access to those programs get them, and then use this funding for things that literally there's no other funding for, a la, getting your driver's license back, getting, certain certificates or things like that for which there's no, or fixing their car engine or whatever. So thank you.
Thank you.
All right, anybody else have questions for Lisa? All right, thank you so much, Lisa, for your update, your presentation to everyone today, and thank you, Rep. Davis, for that excellent feedback. And with that, we'll move on to item number 6. So we've got Vicki Ibarra from DCYF providing a follow-up to 6109, as well as I think some other updates with DCYF's work. So Vicki, I saw you on earlier. If you're ready, the floor is yours.
Thanks so much. It's great to be with you today. I'm Vicki Ibarra. I am Assistant Secretary for Partnership Prevention and Services at DCYF. Been in this position since October. Before that, I was Director of our Data and Research Unit. And I've been asked today to share some information with you related to 6109. You'll see that I've contextualized that in the long-term trends in children entering out-of-home care. 6109 is a new piece of legislation, went into effect just last month, hasn't even been into effect 30 days. But I'll share with you some training and changes in child welfare practice that have resulted from that, again, in the context of the long-term trends. Can y'all see my slide deck okay?
Yes.
Yep.
Okay, great. I don't see it on my screen. There's probably a good reason for that. All right, so we'll cover in the time we have long-term trends, more recent impacts of 1227 and plan of safe care policy changes in 2023, trends on critical incidents, and then child welfare practice impact of 6109. Since fiscal 18, Washington has seen a 36% decrease in the number of children entering out-of-home care when counted as a point in time. This trend largely is consistent with national trends where we see decreases in children out-of-home care since about the same time, 2018, 2019. And then, of course, with the pandemic, we saw a substantial decrease. Since 2020, DCYF has seen an increasing percentage of high and moderately high risk cases being re-referred to CPS intake. So that's just an outgrowth of a decreasing number of children entering care, we think. Got some numbers here for you. These are publicly posted on our website. Anytime anyone's interested, you can take a look. But this is the long-term trend of children and youth in out-of-home care through 2023, both at a single point in time, that's the yellow line, and total number of children who experienced any out-of-home care that year. Both have decreased along the same trend, as I said, since fiscal 18. This is the trend in the high and moderately high risk cases that I mentioned being re-referred within 90 days. This has mirrored the decrease in the number of children entering care. We believe these are cases that otherwise would have been or may have been may have represented children placed in out-of-home care, are not, but still are assessed as high and moderately high risk. And there's a increasing churn among those cases that's happening in the front end of child welfare. In 2023, as I think this group knows, there were two new substantive policies that went into effect that impacted this trend. Both had the intent of reducing removals, and both had that impact. 1227 made a number of changes, including changing the threshold for child removal, and Plan of Safe Care was a federal policy that we'd been planning on with our partner agencies for a number of years, and just happened to go into effect in August of 2023, 1 month after 1227, and was related to how substance-exposed infant cases are handled. Prior to the changes in August of last year, we would receive referrals on almost all of those cases. And now there is an alternative community pathway so that mandated reporters do not have to report all of those cases to DCYF. At the same time, as you know, we have a fentanyl crisis in the state that is affecting many children, and an inadequate access to substance use treatment and other community-based supports for families that are coming into the child welfare system. Since 1227 and Plan of Safe Care changes went into effect, we've seen almost a 20% decrease in the number of children entering care. These data are updated quarterly on our website, and I've got the link here at the bottom of the slide. So there will be an update this month. I expect we'll see it not quite as high as 19%. It seems to be moderating with each month that goes by. But here you can see the geographic distribution of those decreases. The largest decreases have been in region 6. That should be 38%. I believe that should be 38, perhaps 48%. Largest decreases in region 6, followed by region 2 and region 1. Region 6 is the peninsula. Region 2 is South Central Washington. And region 1 is the rest of Eastern Washington. We get lots of questions as to whether the decrease in entries into care have resulted in an increase, for example, in voluntary placements or in protective custodies or in other court-approved placements. And we see here that all of those have decreased over a similar period of time from the year previously. There is an increase in family voluntary services. So this is a category of cases that are not where the child is not placed in out-of-home care and the family elects to remain in case management, receiving family voluntary services. Those have increased a bit. You see here over the period of time that was measured, about 170 additional cases. It is not the same volume as we've seen in the decrease in number of children entering care. When we look at age group the largest reductions in out-of-home placements are among infants, and this is largely because of the changes in plan of safe care, we believe, where we've seen a 26% reduction. We've also seen a fairly large reduction in the number of children ages 12 to 17 who are entering care. At the same time, and unrelated to those two pieces of legislation, has been a substantial increase in critical incidents that we're required to review. These are child fatalities and near fatalities that are suggestive of child maltreatment and for which the department has had some involvement in the last year. We are required by statute to do case reviews and make recommendations on changes in practice or systems based on those reviews. Those are all publicly available. And we see here that in 2023, the number had increased to 51. Most of these are very young children, and 33% of those involved fentanyl or opioid, and often those are accidental ingestions. You see the numbers here for 2024 are quite low, and that's only because this is just the first quarter of, this is reporting on just the first quarter of 2024. But our projection is that the total numbers and the fentanyl involved numbers will outpace 2023. It's important to note that this trend happened at the same time as the changes in 1227, a plan of safe care, but they are not causally related. We don't have any reason to believe that these are causally related. Then in terms of 6109, you all are, I think, fairly familiar with this piece of legislation. The legislature found there was an increase in child fatalities and near fatalities involving fentanyl or high potency opioids. Fentanyl and other highly potent synthetic opioids pose a unique and growing threat. Even in very small quantities, these opioids may be lethal to a child, especially a young child. The legislation provided clarity to judges, caseworkers, advocates, and families about the safety threat, increased training and resources for state and judicial employees, and provided some additional supports for families in crisis with interventions and services to minimize child trauma from further child welfare involvement. The legislation directed the court to give great weight to the lethality of high potency synthetic opioids and public health guidance from the Department of Health when determining if removal was necessary. It provided the agency DCYF with legal liaisons to assist the department and the Office of the Attorney General for preparation of court cases. It also made some changes in protective custody and hospital holds related to the use of high potency synthetic opioids. It established for a work group with the Department of Health, including DCYF and the Poison Information Centers, to oversee the production of this public health guidance on high potency opioids. The work group has not yet started, but because we needed something in place when the legislation went into effect on June 6th, Department of Health pulled together an internal group and published their first initial public health guidance so that the department and the courts had something to use, with the idea that once this work group is convened, that they will provide regular updates to the guidance. The legislation provided for court training to develop and make training available to judicial officers and system partners regarding child safety, as well as how to apply the child safety framework to crucial aspects of dependency cases, including safety assessment, safety planning, and case planning. The legislation provided for additional funds for services for families. We were directed to contract for childcare slots for safety plans in high need areas of the states, to expand our evidence-based home visiting programs in high need areas of the state. It directed Healthcare Authority to expand evidence-based services for children and youth with prenatal substance exposure, provided a pilot for evidence-based in-home parenting services. That's the Intercept model that will be implemented in 2 areas of the state. It provided DOH promotores to provide health education, and it provided us a pilot for third-party safety plan participants and public health nurses, as well as fentanyl testing strips. The The slides I'm going to show you from here out are slides that have been developed as a part of DCYF training of staff. So these are trainings and expectations that have been communicated to staff, are being communicated to staff as a result of the 6109 changes. So we're educating folks on what resources are available as a result of 6109 or will be available as soon as the contracts are in place. And we're ensuring that staff have the resources they need to do assessment and safety planning, even in the presence of high potency synthetic opioids. So they are given direction on expectations related to safety planning, orientation to the DOH public health guidance. They're trained in environmental safety and to consider the overdose risks to children. They are to assess where substances and other paraphernalia are stored and found, determine if someone has seen the child get access, ask whether someone regularly uses soap and water to remove possible residue from surfaces, assess whether a person using high potency synthetic opioids has a practice of washing their hands with soap and water. And the expectation is that environmental safety must be discussed with parents and caregivers, household members, and collaterals, both to assess and as a part of education and harm reduction. We're building harm reduction into our practice, have been for some time. It has some specific components when it's related to high potency synthetic opioids, but harm reduction is built in. Harm reduction includes education about storing substances safely, and we are able to give out both lockboxes and naloxone, and that is, our caseworkers are doing that, and we believe it is saving lives. Making sure children are cared for by a capable person when a caregiver is using, education on keeping naloxone available and knowing how to use it, disposing of paraphernalia safely, safe sleep practices with infants, storing substances and paraphernalia, accessing quality childcare and respite care, use with a trusted person, treatment for opioid use disorders so that referrals are made, medication for opioid use disorder, transportation, plan of safe care, et cetera, et cetera. And then finally, our overall message is that yes, we can safely plan on cases that involve high potency synthetic opioids, so long as we can reasonably expect that there's a physically safe environment with a parent, that the threat is sufficiently understood and predictable, that there's agreement, cooperation with the adults in the home, and that there are sufficient resources for the family to be able to follow a plan. So our overall approach is one of harm reduction and balancing the safety of the children in the home, particularly young children, as well as the requirements of the legislation. With that, I'm going to stop and happy to answer questions if there are any. Thanks.
There is a question in the chat, and Caleb, I see your hand up as well, so you'll be right after this one. Where can info be found on the different assessments for HPSO versus other types of compounds?
The assessment, our safety assessment is the same. The safety assessments, we use the structured decision-making assessment. I can look up those resources, but the SDM, I believe there's a website, a page on our webpage that speaks to the use of the structured decision-making.
Thank you, Vicki. Caleb, go ahead.
Good morning. I saw on the harm reduction slide you mentioned medications for opioid use disorder. You mentioned transportation medications for opioid use disorder, which is great. I'm wondering what efforts are being made to actually bring the medications to people in their homes. That seems an essential thing to do, and it's something we're seeing a lot more of. And given the fact that that can stabilize a person with opioid use disorder within hours, seems the most impactful thing that could be done, and something that, if I had anything to say about it, we'd be putting all the resources into delivering and pushing and proactively making medications available to folks. I'm wondering what resources DCYF is able to bring to actually bring healthcare providers into the home and or use telemedicine to get people medications initiated and delivered to their homes.
Thanks, Caleb. I appreciate the question. I think that our program manager staff and our caseworkers would be really open to hearing more about the resources. I think in a similar meeting, we heard about mobile MAT, where there were mobile units delivering medication. We would appreciate the opportunity to partner and be able to refer for those kinds of services. Our caseworkers are not able to bring medication themselves into the home, but if there was a referral that could be made, we'd be happy to partner to talk about that.
Yeah, and I do think it'd be really helpful to know, and I'm not expert on the legality of it, but in how to have a nurse on site, how to have a prescriber with telemedicine, how medications can be delivered to the home on the same day that that person is seen. That is a doable thing, right? We have the technology, we have the resources to do it, and it seems like that's the most important thing. I understand that there's an environmental risk perspective being brought to this, and a hazard perspective, but it's very solvable. And I see very little emphasis on that in the law, and then also sort of the current planning. And I really hope that can be brought to bear next week. It's just essential. And we're seeing healthcare providers who are doing this. They are going out and finding their unhoused clients where they are and delivering medications to them. You know where people are, hopefully, most of the time. So I'm really hopeful those resources can be brought to bear. Thanks.
Thanks, Caleb. I appreciate that.
Yeah, and I see, John, go ahead.
John, you're on mute.
Still can't hear you for some reason. John, we'll come back to you. Representative Davis, do you want to go ahead?
Yeah, thank you. I just wanted to piggyback on Caleb's suggestion. I also just wanted to give some context. Unfortunately, it's I don't mean this with disrespect to anyone who worked on this legislation, but it was my perception that the service piece of the bill was fairly not well connected to the population intended to be served. It was sort of a grab bag of services that I didn't feel like there was as much consultation as there could have been or should have been with the target population of parents, parents with SUD, in terms of defining what those services would have been. And the way that the legislation was written didn't even specifically target, for example, targeted childcare slots. It was just targeted childcare slots in regions that have high rates of, I think, child removals because of high potency synthetic opioids, but not necessarily tied to those specific families. To Caleb's point about the one piece of the service array in the bill that could potentially connect with Caleb's notion of bringing medications into the home would be the home visiting programs. So I am not familiar with all of our home visiting programs or which one is going to be funded in the legislation. Maybe HCA staff or DCYF staff can shed light on that. But if the one that's going to be expanded is the nurse family partnership, given the name, it's presumably nurses that are going into homes. And so I do wonder if that's happening, if in the context of nurse family partnership or other home visiting models that involve a medical provider visiting, are we trying to infuse MOUD into those pathways?
Thanks, Representative Davis. That's a great question. Nurse family partnership is one model in our home visiting array of models. It is the only one that has a health professional. We haven't yet chosen the contractors or the models. We have to go through a competitive process in those geographic areas that were identified in the legislation. It is, although nurse family partnership could be one of the models, it is unlikely, given the way the model is structured, that it will be highly used in this context. As you know, nurse family partnership starts home visiting during pregnancy, and most of the referrals we're talking about are not involving people who are pregnant for the first time. So it's unlikely, although we could think about it we could think about that medication delivery for the public health nurse model. So I appreciate the suggestion. Thanks.
All right, John, let's try it again. Go ahead. We'll see if we can hear you this time. No.
Yeah.
All right. If you're able to use the chat feature, if you can plug in your question in the chat, I will forward that. I'll speak it on your behalf. And in the meantime, yeah, Malika, go ahead.
Thank you for your presentation. I have a few questions actually. So I wanted the numbers that you showed about the critical incidents, was that, you said percentage, but I was wondering, or was it proportional? Because it was, it said, is it 33% of the 51 or 33 out of 51?
33 out of 51. Sorry for the confusion.
Okay. And then also I wanted to know, what are the fentanyl test strips going to be used for?
I don't have an answer to that. I can get an answer. I apologize. I don't know.
Okay. And since harm reduction activities across the state are under attack and access to treatment and sharps containers is something that is decreasing, especially in some of our smaller communities, I was wondering, will they be handing out ways for people to lock up their paraphernalia, such as sharps containers and such? Because I didn't hear that as one of the tools that was going to be available.
We do give out sharps containers now, as we, in addition to lock boxes. So they may not be on these slides because they may not have been funded specifically, but I'll check for that. We do give those things out now.
Okay. And going back to the fentanyl test strips for a minute, there's a high rate of false positivity with that tool. And it's not designed to be used as an investigative tool. And during legislative session, there was a lot of one of our concerns at Vocal Washington was that that was how it was going to be used with families. And then we were told that it was going to be used as a relationship building tool for the individuals that are using drugs. So I just want to make sure that that is still the case. So that's where my question comes from specifically, just to give you some context of why I'm asking that question.
Thanks, Malika. They are not used as part of an investigative tool. They are not part of investigation, clearly. They are used in the kit that's left with the families and as part of education for harm reduction. I do know that much.
Okay. And so I'm wondering, how are workers using the situation where essentially when CPS is involved with your family, threatening to take your children away doesn't usually engender trust. So what tools are they going to be using to mitigate that in order to get people to honestly engage with them and like to building trust? What specific things do you know as a part of their training are they doing, so that maybe, those of us that are working with folks directly can say, well, this is part of the training that they have, and this is a sign that they want to work with you.
Mm-hmm. Yeah, so our training for all of our child welfare caseworkers includes training on engaging families. More recently, in the last year or two, we've added motivational interviewing into that training toolkit. So staff are trained. They are also trained on harm reduction and non-judgmental approach. I can't speak to the quality with which that's carried out throughout the state, right? With 2,000 plus caseworkers across the state, there's probably some variation as to training level competence. But we try to make sure that staff have the resources available to do that well, do that engagement well, do that trust building well, and then do case planning and safety planning with the intent of safely avoiding an out-of-home placement.
So I'm wondering then, if there's no way to guarantee like the degree to which this is being carried out in a manner that is in alignment with the intent, is there a way to measure, or would DCYF be willing to measure their staff on their engagement, and outcomes? Because one of the things that was really concerning to me about this particular bill is that all of this mishmash of things that is not very specific, as other people have mentioned, is going to be thrown at people. There's not services that are even paid for or outlined yet, but the law is already in place. So the consequences are already going to be occurring. Is there anything that is going to be happening to measure the impacts like across the board? And also, could there be some measures identified? I'm looking at you, Caleb, because you're the epidemiologist here, but like, the impacts that like the psychological impacts on families and on caseworkers for that matter, of doing this work and whether or not it's actually achieving the safety that it is, I'm being generous here, intended to provide.
Thanks, Malika. Those are great questions. And I'm a data person too, so I appreciate we will be monitoring outcomes. So these kinds of data that speak to the result of, this is an after the fact, so it's not an in the moment, which I think is more of what we're looking for. But the number of children entering out of home care will certainly be continuing to measure that. The risk level of families, we can report on that. The number of, the geographic distribution, the number of children who are subject to critical incidents. We can measure all of those things, but those are lagging numbers. In terms of engagement, we've talked about how to measure engagement among our caseworkers, and there are some broad measures that we look at, right? How often are the caseworkers seeing families? We can look at those kinds of things. We can look at the number of children who are removed with substance use involved. Are those going up and down? Are they different for the ages of the children? Are they different geographically across? I'm not sure any of that gets to what you're speaking to, but we'd be happy to talk about it.
Yeah, thank you for sharing that. And no, it doesn't. Because I think that is really, we keep bringing up old tools that we did this during the crack, period, making the distinction between cocaine and crack. And, the whole drug war was designed to impact certain groups of people. And so making these distinctions that, and I am not saying that fentanyl is not a dangerous thing. I've lost more people than I care to talk about. This is personal for me, as was the crack epidemic, like the impacts of that on family. So I don't want anybody to take away from what I'm saying that I'm minimizing this. But when we resurrect old ways of doing things and we don't actually get at the harms that are being perpetuated by these changes, but we are saying that we are engaging in a degree of moral panic and saying that this thing is so much worse than anything we've ever seen before. And it is bad. So I'm not saying that it's not bad. However, we're not actually holding ourselves accountable to whether or not the response is in alignment with what is best practice and what will actually create the outcomes that we say we want to see. And the fact that we're not looking at any new or innovative data points in order to get at that is super concerning to me, especially because we finally made some, progress through some of the suggestions of this group, and then we're moving backwards. So, and this isn't like, I'm not trying to rake you over the coals. I hope that's not the way that this is landing. But these are just real concerns for us.
Thanks, Malika. I appreciate your comments. And as I said, we'd be happy to talk about if there were ways to do the kind of measurement you're talking about, or that this group would suggest. We'd be happy to engage in that conversation. I come from a prevention background myself. I've also been personally impacted by the current epidemic, and yes, I'm interested in doing right by families. Okay, I want to make sure that I answer some of the questions in the chat. Thank you, Emily, for the offer. Lucilla, yes, Family Spirit can be an option. Family Spirit is in our home visiting service array, and yes, it could be one of the options. Do the statistics for critical incidents, thank you, John, include the overdoses for Green Hill? No, they do not. These are critical incidents for fatalities and near fatalities for children who have had child welfare involvement in the last 12 months. Most of the overdoses at Green Hill were among residents who wouldn't have fit that fit that definition, so they do not. For the bill text, the fentanyl test strips are to be given to DCYF staff to use on scene or to distribute to families. Yes, thank you, Representative Davis. Can family spirit? Yes, thank you. Okay, I think I've answered the questions in the chat. Let me know if I haven't or if there are any other questions.
Vicki, there's one question. Do the DCYF caseworkers doing this work have any specific specialization in SUD or hold SUDP certifications?
No, that is not a requirement of staff. We were given funding to put SUD professionals in the regions to help support the caseworkers and work directly with families on referral. We were directed to put 2 per region, so 12 throughout the state, but we were only given enough money for 11 staff. So one of those regions is only going to have 1 staff. It's not near enough given the need, but we do have some SUD professionals who will be under contract to do some of that work. Thank you. Nikki's question, will we be tracking which resources referrals are utilized? We have some information from our case reviews as to which types of services that families are referred to and engage in, but we do not have consistent quantitative data. We are working right now with RDA and HCA to stand up some regular reporting related to treatment penetration. RDA did a wonderful report for us back in 2020 using HCA data that identified the need for substance use treatment among the caregivers we work with, and their service penetration, the treatment penetration rates, huge variety across the state. Some areas of the state, lots of our caregivers were able to get into treatment in other parts of the state. Not surprisingly, they were not. So we're trying to follow up on that and get some more recent data on that so that we can use it in service planning. So we will have that in terms of once the data are available, we will know what the treatment penetration rate is. Thanks, Caleb. PCAP's a terrific model, and we have received money in recent legislative sessions to increase the number of slots. It's a terrific model. All right. Thank you all very much. I appreciate the feedback, and I will definitely take this back. Thank you.
Thank you so much, Vicki. All right. So next item is the RNP highlight. So I will pass that over to Leisha Coates. If you're on.
I am. Hello, everybody. Good morning. I apologize. Unfortunately, I cannot be on camera. I have a family emergency that I've had to go to, so I'm currently driving. So I have I'm the Recovery Navigator Administrator for the Great Rivers region, and I have Destination Hope and Recovery here, who's our contracted provider for all 5 counties, Joey Banish and Robin Kozad. And I'm going to kind of hand it over to them and let them kind of give some highlights of the Recovery Navigator program, what's working well, maybe some success stories, answer any questions if that is okay with everybody.
Thank you, Leisha. So hello, everybody. My name is Joey Banish. I'm the founder and one of the co-owners of Destination Hope Recovery. I'm currently serving as a program supervisor of our Kalasawakaikem location. I'm just going to give a little backstory of where Destination Hope and Recovery came from. So I created the agency in September of 21 as a sole proprietorship. And I remember when the Recovery Navigator program and RFI came out for it, me researching it, and being a peer with over 20 years of lived experience with dealing with addiction, mental health, and researching what LEAD had did in the King County area with their program and how the Recovery Navigator program is a LEAD-like program. It really was resonated within the peer within me, thinking, oh my God, if this program was around back in the day when I was struggling with my addiction, with my mental health, it would have had such a huge impact on me back then. And the want to bring that to Pacific and Grace Harbor counties was far and beyond my hopes and dreams and everything like that to get that program. I ended up putting in for the program at that time, and I ended up securing it. And it was so amazing to get word of the contract. We ended up rolling it out, and at the time, I only had a home office, but meeting the client where they were at out in the field with my staff and bringing on 5 additional staff at that time, it really resonated within the law enforcement with the different stakeholders, showing them that we are out, boots on the ground, meeting the client where they're at and making that impact. And throughout the last 2 years, an RFP came up for Lewis County for the Recovery Navigator program. We put in for that with, I think we got 15 letters of support from different stakeholders throughout Grace Harbor and Pacific County to take to Great Rivers and the committee that was overseeing the RFP. It's my understanding that it was unanimous throughout everybody that they wanted us to come to Lewis County. And I remember when DHR came into Lewis County, a lot of people were like, well, this has happened, that's happened. And it was so political at that time. And us showing up, keeping our word to the different law enforcement, to the different stakeholders, really showed them who we are as an agency. And being peer ran, I think that peer aspect of it to bring into the program has really made a huge impact throughout the region, throughout the state, honestly. And as we continue doing the program, we ended up getting the contract for Calaswakayakum several months ago. And it was the same situation when we got the contract down there. And Leisha did an amazing job of doing all the introductions to different stakeholders down there. It was always a common thing. Well, people have promised us this or that, and they've never kept their word. And now the praise, the feedback throughout the community has been pretty amazing to hear how it has came full circle. But since September of 21, now we have 38 staff members when it started off with just me. So it really shows the power of peers and what peers can do when we put our minds together and do this hard work that really impacts our lives. I do want to take a second and thank Malika. I love hearing her passion when she talks about different things. I think a lot of attention needs to come to the drug epidemic, and there's a lot of work that's in front of all of us that we have to do. I am going to hand it over to Robin Kozad, and he's going to get into a little bit more information about the program.
Yeah, hi. So I don't know if you guys can see my screen. I've been having some technical difficulties, but do you see the Destination Hope and Recovery screen there?
We do.
Yep.
Perfect. I don't actually have very much in the actual slides portion. I kind of utilized something that we'd done before and made presentations in our Board of County Commissioner meetings and things like that. So my focus on our Recovery Navigator program team is that I am a program supervisor as well as the other co-owner for our agency. I really focus on the quality of services that we're providing within the communities and our data reporting. So some of the things that I really do is within RNP is not only overseeing our Lewis County staff members, but also overseeing how we're collecting things within the counties, utilizing the tool and the data collection tool that HCA has for us, and then seeing whether we can't go deeper. So in every interaction or attempted engagement that we have with individuals, we're tracking their level of engagement, whether we were able to contact, whether we found them, but they didn't want to engage with us, and going up until kind of minimal and moderate levels of engagement with us, up to the point where they're seeking us out. So some of the things that we've done with that is utilizing that knowledge to see more quickly whether someone is potentially ready to move into intensive case management, right? Because they're moving up those levels where we were constantly outreaching, can't find them. That's a huge part of the program. About 50% of our contacts are attempted. And so when you look at the data, it actually looks like 50% of the time we're just not finding people. But that's, to me, that's actually a good thing. because it means that we are continuously going out there and seeking people out. And then seeing when they take that change, when their stages of change are, when they're moving across those stages of change, and we can potentially connect with them, and maybe get them into programs that may be better fit at that time once they do start to actively engage. Now maybe they're willing to do some more case management type services that can be done within the community. Obviously, referrals and connections to services and resources are the majority of what the staff do on a daily basis. We track every referral that we make out and every referral that we receive. We've currently, and as Joey said, we've been working providing RNP services in Grace Harbor and Pacific counties since the beginning. Lewis County for about a year now, and Cowlitz and Wahkiakum counties for about 3 months. And over that time, right now, currently, we've had 914 unique individuals that have been referred into us, and we've been able to serve in some capacity. And that's a lot. We're small area where every county that we serve is rural. The resources vary from county to county, including the resources that are meant to be consistent, right? You would think that governmental resources, agencies would have same processes and things, but there's unique differences that we've kind of had to tailor our services to. We've been very focused on law enforcement engagement with our programs. It's very clear that, out of the original bill, and as we've kind of progressed into this newest bill, really we want to be diverting people away. So we've got great engagement from the officers on the street level and their chiefs and commanders, and are able to actually get people with diverted substance possession charges and public use charges in Grace Harbor counties, including some that could have been DUIs potentially, but maybe they were able to connect them over to us instead. Lewis County, we do one of the coolest things that I've seen since we've been in Lewis County is that through our work with Centralia Police Department, they were very skeptical in the very beginning of us coming into the county, as was every service provider within the area. It very much was someone new is coming in. We don't know how they'll provide services, or if we'll be competition or anything like that. We've really focused on just a recovery navigator program as what we're trying to bring into the counties as we move in, and making that sure that that's what we're focused on. We're not trying to do we're not an SUD provider, so there's no billable services going on in that way. And so there was a lot of contention and things that we've had to kind of overcome through that. And we started right off the bat by inviting everybody that we could find or that wanted to meet with us, come to our office, speak with us, see how we can provide services and how we can work together. So we started doing outreach with the Centralia Police Department, which was going well. We were doing it a couple times a month, and things were kind of just progressing. We were getting contacts out of that. We didn't necessarily refer everyone we contacted into the program, because we really wanted to make sure that it focused on whether they actually wanted our services or not. But then for a while, some of the officers started arresting more and start citing more for various reasons. And so we had a conversation. We called up the commander and talked to the chief, and talked about really our intent of being out in the field and the way that impacts our relationship and ability to work with individuals. If they see us partnered with law enforcement officers, that may be fine. If they see us partnered with law enforcement officers and they're getting arrested, those are things that impact our ability to build a relationship with them. And so we had those conversations, and since we've had multiple back and forth communications and things that have gone out to the entire police force that have specified that we're out there so that we can gain rapport and that the officers can gain rapport with individuals. And so there's no more arrests happening. There's no more citations. I think the staff last week said, oh, they let somebody off with a felony warrant. They didn't pull him into jail. They just connected him with us. Which in the past, that would have been very much what they've done. So we've had some definitely some systemic changes that have been happening. It's been really cool to see. As we've moved into Cowlitz and Wahkiakum, we face the same. Joey has worked really hard along with Leisha and our project manager for the region and really getting connected with all the community partners. And we've really made law enforcement a focus down there as well. Some of the successes that we've had, I know that I just asking the staff this morning, you know, I was like, what are your most impactful successes? And some of theirs have had to do with individuals that are referred to us through that are already intersecting with the criminal legal system, like individuals that are currently in drug court. We have a fantastic relationship with drug courts in all of our counties and therapeutic court programs. And when they have individuals that are showing that they're still really struggling, they're in that first phase, and they're really struggling, they may be experiencing intermittent relapses, they're able to connect them over to us, and we can provide an additional peer that will walk alongside them and assist in some of those areas that no other programs do. So the flexible funds that came along with the contracts that really are very open for us to kind of tailor them to the individuals we're serving is inexpensible because so many other programs have this requirement. But for us, you know, one of our first families referred to us was on the streets with addiction issues in Lewis County, and we were able to connect with them. It's a family of 4, and we were able to help them in addressing the needs that they had. They were homeless, having lost a home in a fire months before, addressing their substance use needs as well, and getting them connected with treatment services and resources. And they've been now, and then we assisted them in paying for the first month and deposit for their housing, and they've been sustainably housed for the last 6 months now, or more. It might be 8 months. One of our very first successes that we had in the program was in Pacific County. Probably our 4th person ever referred into the program. Now 2 years later, currently works in a behavioral health agency as a peer, and has had the, you know, requisite sustained sobriety time to do that. So I just to reiterate what Joey said, I think that, you know, when we have the opportunity to provide the program services, we really saw Recovery Navigator program as being something unique and something new that changed the game within the behavioral health world, because there are so many barriers. So we're working on additional ways that we can improve our services. Like I said, our referrals, you know, as far as HCA's tracker it goes, we just make the referral and it shows where we're referring people to. But we go deeper. I can pull reports on every agency that's referred into us, how many individuals they've referred, how many we've referred back, whether those were successful referrals, things like that. And just trying to really dig deeper and see what more we can do. One of the more recent things that we did was Joey and myself, mostly myself, has been attending and am now a member of PTAC's National Leader Council, which PTAC is Police Treatment and Community Collaborative. They're a very large organization focused on diversion and deflection work all across the country and internationally. And so learning from them and learning from a lot of their other ways to provide deflection and diversion services and how we can tailor and how we can implement those into the ways that we work. So it's really, really very cool. And that's kind of, I think that's kind of what I have to provide.
Thank you so much. I know that we've got a few questions in the chat. I just want to say it's so encouraging to hear the success stories. And I just really appreciate all of the information you've shared. But yeah, there are a few questions in the chat. And Tony, did you want to take those? I know it says for the RNP administrator, but I think you said you had some information you can provide.
Yeah, it looks like Rep. Davis had a couple of questions. One, can the RNP administrator please share why Gathered Church lost the Lewis County RNP contract? And then the second was, would also like to hear who the former contractor was for Wahkiakum and Cowlitz counties and why they lost the contracts. Thanks. Not sure if anybody from Great Rivers is online that would want to address those questions here, or if you would like to address them offline as well, we can get you Rep. Davis's contact information. So would defer to Great Rivers on those questions.
Yeah, I think the most appropriate thing is to have that conversation offline, and I'm certainly open to doing that.
And then it looks like, thanks, Leisha. And so maybe you can put your contact information in the chat. And then then there's a comment, drug court participants have an unusually large amount of resources and drug courts can explicitly pay. Well, everyone can read it in the chat, but I wasn't sure if anybody from Destination Hope and Recovery had a response to that in terms of when you're partnering with drug courts in those counties, how the limited resources for RNP compared to resources that drug courts have, how to ensure that a participant from that might be in both programs, how to prioritize funding when that happens.
So usually we're only working with drug court participants when they're in that very like first or second phase, when they're not stable at all in their life and they really need that extra hand-holding. Usually when they start phasing up, that's usually when they move off the Recovery Navigator programs caseloads and are mainly just working with the drug court. I know like for like Cowlitz County's drug court, for example, they don't have a huge funding pot of money. They have less funding down there for their participants than compared to maybe Lewis County. Lewis County has different housing options and stuff like that for their participants. Cowlitz County doesn't have any like Oxford sober living contracts with local providers, in my understanding, that they can maybe plug them in with. But the funding that's probably used for them are probably just to help them like that initial, okay, you need ID, you need that, you need some food, probably, okay, do you need the cell phone in order to stay in communication with your drug court case manager in order to make it to court and stuff like that. Maybe being the extra transportation piece to get them to their drug court hearings as well. So it's not like a huge, well, I guess it really depends how you look at it. I don't want to take anything away from a little bit of funding to somebody, because a little bit of funding to somebody might be a huge amount in order to get them maybe that cheeseburger or something like that from McDonald's when they don't have no funding compared to what maybe drug court could have. So they just have different, each area has different funding options, I guess, so to speak. But we're only with them usually the first and second phase, and they move off. Robin, do you want to add anything to that one?
Yeah, I think just what you said, Joey. I think that our staff are very good at utilizing community resources first. So when someone is connected with drug court, obviously we're going to focus on them utilizing those support services and any flexible or funding that comes through that. So usually that takes care of things like, I know Grace Harbor County Drug Court will pay for housing and pay for cost related as well. So we're not making our focus on those things. It's definitely very much on other individuals that do not have those resources we're able to utilize, like that family. They were not participating in any sort of court program, and actually didn't have any legal system involvement other than being homeless on the street with children. And so we hope that what we were able to do was really prevent them from having more criminal legal system involvement, or potentially having interactions and going through DCYF, right? Because we want to get people as far upstream as possible in addressing those issues. Something that I was just thinking about was, I know that there was talk earlier about really understanding benefits and work incentives and things like that. And that's actually something that's going to be a new focus of ours. Currently, we have some staff members and myself and actually myself that has gone through to become a work incentive practitioner and be credentialed through the Social Security Administration. And so that's something that we kind of want to expand into our Recovery Navigator program as well. We do benefit work all the time because we have individuals that are referred to us that receive or are eligible for government benefits from federal and state sources. And so we really want to improve the way that we can provide those services to tailored populations. And we do the same in our staffing. We have staff members in each of our areas that are veterans and have experience with veteran systems. We have staff members that are very much mental health and family or family peers with family and with lived experience. And then some of our staff members that are very experienced in working with youth and children. So when we receive referrals for individuals that are youth, we're able to connect them with them to really leverage their experience and provide really direct and specific services.
Thank you.
All right. If there's any final questions, I think we have time for maybe one more, and then we'll need to move on to reviewing the agenda for the next meeting. So if anyone else has questions, just open that up for another minute or two. Yeah,
this isn't really a question, it's a comment. So in the future, when we're getting these reports, I think it would be really helpful if the providers don't provide or don't editorialize around what the perceived I think just because to Representative Davis's concern that she brought up, there's a lot of dynamics that happen in communities, and I think that it can be potentially harmful to comment on. I'm trying to find the most diplomatic way to say this. There's a lot of factors, including competition and political concerns that happen in a lot of different regions. And I don't think that it's helpful for individuals that have been a part of that competition, no matter who they are or where they come from, to editorialize around what their perceptions from their perspective, especially when another entity isn't able to discuss it, or we're not getting the full picture of all of the dynamics. For that to happen in the context of this meeting. So I'm requesting as a member of the SURSAC that that be taken into consideration. I hope that made sense. So speculation about why something changed or, things like that. Changed hands as far as case management services.
Yeah, thank you for that, Malika. That's a great point. All right, so moving on to review of the August agenda. Kelly, do you have that ready to pull up? Great. Give that a moment.
Hello, everybody. So for right now, the lead is TBD. It's to be determined. Tony will let me know for the next meeting so I can change this agenda. This is the draft agenda for right now. Public comment, walk-on items requests. We do have law speak on here. That's to be determined. We didn't do it this month. We're looking more into other factors when it comes to law speak about the future, about speakers and such in SURSAC. Next meeting, we will have expansion of housing options for individuals along continuum of use and recovery. Lisa Bennett Perry. RMP highlight is to be determined. And then Blake will be back with us to move on to public comment and more on items. Is there anything on here that anybody want to give any comments on?
Or items you want to add to the agenda?
Can't see my chat, so.
Oh, yep, there's nothing in the chat that I'm seeing. So as usual, Kelly will send this out as well for feedback. So you've got a bit of time to provide any feedback on the agenda. It sounds like, Malika, go ahead.
Actually, so I wrote this down, sorry, as a note, when we were talking earlier about when Tony mentioned at the beginning of the meeting that, when the law changed to the gross misdemeanor from the misdemeanor, and one of the things that came up to me, in my thoughts was it would be interesting to, hear about, the increase in overdose death rates after that law, changed, and also the increase of in custody death rates. And Seattle Times just released an article about late night jail releases and that they leave folks with nowhere to go. And this is just like off the cuff, but it would be interesting to, I don't know if we have a conversation or if there's a community somewhere in the United States or in the world for that matter that has maybe stopped having late night jail releases when services are closed and people don't have access to those supports, because a lot of the Recovery Navigator programs, for example, are not 24/7 yet. And nor are they at a place where they could scale. But if we could look at how those changes in the law and the increase in incarceration, how that's impacting the capacity of Recovery Navigator programs to be able to engage in either court, the prosecutorial referrals that can happen, or diversions, excuse me, because a lot of them don't have the capacity to be able to do that, as well as and what that impact is from other measures on the individuals that we're trying to help. So I know that was not super well thought out or very specific, but I think that it would behoove us as the SURSAC to look at issues concerning these changes and what impacts they've had.
Yeah, I mean, this is Tony. I think that makes sense for sure. And, would kind of look to Danelle Tanksley and Chad Enright to maybe, for the next meeting, be able to come and like represent at least what their associations are hearing in those contexts, from the Prosecuting Attorneys Association and the Sheriff and Police Chiefs. But we'll definitely kind of figure out the best way to kind of hold space for that conversation for the next meeting. And we might follow up with you by email just to get some additional context too.
Right. And I would also ask that we go beyond just law enforcement, because they're reporting on what they report on, which is cool. It's not a criticism. But I'd like to get a broader perspective, since the intention of this was to keep people out of the criminal legal system, how is that being impacted? And so maybe that means we need to have a meeting and talk about it a little more thoroughly and dive into it. But these are just concerns that come up to me as a member of this group.
Yeah, thanks so much.
I'll also add that all the questions that Malika had, I think, are very good questions, and hopefully I could get a list of those questions, at least from my agency. I could provide some answers. I will say, with regard to the late night releases, that's super uncommon here in Whatcom County. I can't speak for the other 38 counties, but certainly would love to do a deep dive into some of those questions.
Thank you, Tank. Yeah, this is great. We'll start working on following up with that, and depending on how much data and how detailed the data needs to be to start sharing that. Can't guarantee it's ready in time for August, but we'll certainly be following up and getting ready to present on that as best we can. So thank you, everyone. I know we're past time, so if you've got to hop off, please feel free to do that, and we will see you next month. Thanks, everyone.